Conference room number accepted. If you are the organizer, press the star key now. Otherwise, please hold. This line is now muted. This conference will now be recorded. For a menu of available commands, press star 1. There are 12 participants in the conference.
Was the overall concepts that were developed from this work group. And another key aspect for the strategy map is that it does help you think about it in a holistic approach, including learning and growth, internal processes, patients, partners, and communities, and financial, one leading to the other, one impacting on the other. They all support each other in a holistic fashion. The other important aspect of the strategy map and balanced scorecard and a systematic approach to planning is that it helps you to not overlook key areas such as learning and growth. You know, learning and growth is really essential for helping to create that internal capacity to help move and drive the hospital toward future goals. So with that, I am going to turn it over to Terry because he's going to build on these concepts in the remaining portion and next webinar as well. Terry?
And Bethany, Terry is running a little bit late, so if you could maybe do this discussion and Terry will jump on in a moment.
Absolutely. So at this point, Terry was planning on just stopping and pausing for a moment and hearing what your progress is today on your strategy map and what you really identified on the last webinar. So with that, to help out, we can just open up the lines and ask if who would like to volunteer first. We'd like to hear about, let's make it simple, just a simple place to start. Really, what did you identify in your last webinar as, say, key concepts that you would like to include in your strategy map?
Thanks, Bethany. I'm going to go ahead and unmute all the lines at this point. So
okay.
If you're not speaking, if you're not speaking, you can go ahead and just mute your phone. And so all phone lines are now unmuted. Go ahead, anyone, or we could start with Big Sur.
This is Jennifer with Big South Fork Medical Center in Scott County, Tennessee. We actually started working on, we want to grow our radiology services, and we're starting to focus on really on stress testing first. We're going to gradually grow other services under radiology, but we want to start with stress testing. So on the learning and growth on the strategic map, we actually need to know the equipment. We need to get it up to par where it needs to be, line up, get that testing, get that certified. Then, of course, we'll have to train the staff, the physicians. Once we get that taken care of, we will actually get the EMR training on the side of stress testing for the staff, physicians, and scheduling. And in the internal processes, we're going to have to learn how we're going to be billing those properly, those procedures, actually do the CPT codes, the pricing, marketing. We'll actually go into the patients and the partners in the community. We'll get our employees and our physicians on board first, and then we'll push all the marketing out into the community to market that stress testing pretty heavily. Once with that, we're actually going to evaluate the needs that's in this community for stress testing and what it takes for our patients here to go to Knoxville, which is an hour and 20-minute drive for our patients here that actually could come here and do their stress testing. So, you know, and what it's going to take on the financial side, the salary cost, the pricing, the quotes for the stress testing itself, and we're going to be comparing, you know, try to do the comparative pricing from what it would cost for them going to Knoxville versus here, and try to be more competitive in that area and actually grow our services and be more competitive on that side as well.
This is a fantastic example, utilizing this template and helping you think through what are those key areas that you really need to think about, using it as an outline so that you're capturing all those critical training steps as well. And loved how you stepped down through it and captured the other key important components regarding operationalizing the activities. You know, again, even the billing and coding, the marketing, and how it's going to impact the financial side. Wonderful example how it laid out. I hope you found this tool, if nothing else, just moving forward for keeping this as a little dashboard when you're thinking about adding on a new service line or exploring new options. That it's simply, if nothing else, a great guide for thinking about what are those key areas and not just, say, the clinical side or not just the financial side, and seeing how it impacts one another, one side supporting the other. What did you feel like when you were stepping through it and utilizing it to think about the action areas, which I know is sort of getting ahead of ourselves? But what did you think? Did it help you come together, divide it out, or did it just sort of naturally come to you? What's your thoughts?
When we actually started working on it, it was a team of 3 managers here. We started working on it, but then we actually pulled in all of our department heads to do input from day one on this. So I think it's helped us to gather our minds and put everything on paper, basically what we want to see the points of, from the time we want to start a service to what it's going to end like, how it's going to benefit our patients and our community, but the nitty and gritty of it. So this actually has helped us considerably.
Fantastic. That is really great. Thank you so much for sharing. That is just a great, well-developed example. So if you did that, you've got the concept. So fantastic. Would someone else like to share?
This is White Mountain Regional Medical Center. I can go ahead.
Yes, please do.
Okay, we selected telehealth and developing that in our hospitals. So under learning and growth, we have training for schedulers, the nurses, the MAs, the providers, and for the billing office, the provider education, and also deciding who will run it. Under internal processes, we have deciding on patient flow, deciding on the workflow, such as contracting with payers and who's doing authorizations, the billing part of it, involving information technology, and also the coding aspect. Under patients, partners, and community, we have deciding on what services are going to be needed, collaborations with other health providers, getting the word out, educating patients, training patients, educating the community, educating the outside providers, other facilities to what we can provide, and getting that out in the community. And then for financial, it is, checking on the reimbursement, the payment, codes, billing process, the cost of equipment, and upkeep, and are there grants available for us to help us with the cost of this?
Another fantastic example. I love it. And particularly, I think you did a great job connecting, thinking about partnerships with other providers. Again, that's something that's, when you're first thinking about setting it up, it's easy to overlook. The other aspect I thought was excellent is your public education, the community outreach, again, that marketing perspective of it. And in both pieces, building awareness of the service, it's also a great opportunity, to continue to make your communities aware that you are growing with the times, that this is needing a new service, a need. You're aligning services with their needs. So again, fantastic example, connecting the dots there, and leading to hopefully another service that's really going to be meaningful, helpful to your community, and impact the hospital bottom line. So that, to me, is always win-win. That's fantastic.
Yes. Thank you.
Sometimes I feel like, sometimes we do things that we need to do it because it's the right things to do, as always. That should be number one in our thought process. And I think in the strategy map helps us to keep that in mind, particularly with the learning and growth and partners, patients, the community aspects. And sometimes, as you know, in healthcare, we don't get to make money off of the services, but when we do build to connect the dots and have a way to help financially support the organization and align with the community need, that's just icing on the cake. That's well done. I hope you found that the tool or approach to thinking about it helped you and your team in your planning.
It did. It helped having the samples, and it helped having it drawn out so that we had to put it in the category so that we could figure out where we're going.
I like that, absolutely. Sometimes we do need a box to sort of keep us in check there. So that's a great way to think about it. Thank you so much for sharing.
Mm-hmm.
Anybody else would like to share an example?
Hey, Bethany, this is Tammy Stevens, Madison County Memorial Hospital.
Hi, Miss Tammy. It's so great to hear your voice.
You as well, Bethany. Our priority was using data to drive decision making. And the learning and growth, we have assessed and improved culture through rounding and survey tools. Create a plan to develop a highly engaged, focused, quality-driven workforce, medical staff, and board of directors. And provide customized professional development for all stakeholders throughout the organization. And departmental policy and procedure infrastructure to ensure that our current IT platform matches up with the updates that we've had to go through with going from one platform to another. And then internal processes, develop dashboards for outcome measuring, monitoring, and improvement, review and update operational and clinical processes for workforce commitment to patient experience, transition of care, and quality outcomes, and modify and customize technology to align with updated operations. And let's see, patients, families, and partners and communities improve patient and family engagement and experience, develop collaborative relationships and connect community resources to address patient needs, document hospital outcomes and demonstrate value of service to the provider, staff, and community. Again, engaging with our providers through lunch and learns and ensuring that we discuss workflow concerns, etc. And then financial goals and productivity, ensure sustainability with meeting benchmarks on CMS core measures and HCAP, optimize reimbursement revenue cycles, and operationalize value-based care and patient experience, research benefits of denials management software and the benefits of contracting with a collections agency. And that's what we have.
I just want to say, wow, that's absolutely fantastic. And this is another great example, really focusing on that data to drive performance, making it meaningful. I know it's so many times that we are just having to collect data or reporting that we actually sort of forget to how best to use it. But to use it to keep it focused like this, where it's impacting all areas, that's great. And tying it with your policies and procedures and your IT to keeping it focused. Wow, that's really going to help you demonstrate that value and keep you focused for the future. And for dashboards, this is a great example to follow through, considering that you'll be working with Terry and Rhonda to create a balanced scorecard. And then also we do have a couple other simple dashboards that anyone is welcome to utilize. We've had a couple hospitals that we're working with here recently that needed quality dashboard. So we drafted that, and that's actually on the toolkit. So that might be something you want to tie into this. And then there was another hospital that honestly just needed someone to help them create a simple Excel spreadsheet with those key KPIs, key performance indicators for the revenue cycle, and to give them something to react to use as a dashboard for the revenue cycle team. So that's available too. So I'm really excited, Tammy. This is really a great example to carry through and connecting the dots, again, with a whole perspective of performance excellence, driving that and keeping value and demonstrating it. This is going to be a great working example to share back out. Thank you so much for sharing.
Thank you.
Anyone else like to share?
This is Lori at Mercy Tishomingo. And so we talked last time about developing a strategic plan to increase utilization of our inpatient hospital services. So we also had a strategy about developing our staff for marketing so we could promote our services, and developing programs to provide specialty telemedicine services. Let's see. We also, in internal processes, looked at providing patient-centric care that builds community loyalty, using our data so that we know, use the feedback that we're getting to help implement improvements in our care. And then just under the learning and growth, making sure that our staff have the knowledge and understanding to provide the care that they need. So if there's specialty certifications or any kind of training that we need to provide, that we would do that. The form itself, I like how it gives you those other areas to think about, but I do think it's a little bit confusing in some ways, to me at least, about whether some of those are interventions for a strategy or whether they're the actual strategies. So I guess that's my feedback on that.
That is fantastic feedback, and it's very confusing sometimes. And I can honestly I've struggled with the same concept. Is that a strategy or is it really an action? How do we want to define it? How do you actually take it and make it meaningful to you? I think, again, using the template to make what makes sense to you, and mostly, again, helping us think to include those key areas. And I believe that as you move over the next two learning collaboratives, Rhonda and Terry can help you think about those, taking it from those strategies to your balanced scorecard. And that's sometimes where I get confused. What do I really want to call it according to the process and that planning, again, to make it meaningful. So that's a good feedback and something I think we should keep in mind as we move forward with the discussions, because you are not alone on that. It can be confusing. So thank you for that. And the comment regarding utilizing data and supporting that feedback loop is just critical. You'll see that as part of that systems planning that Terry's going to include. So by any chance, oh, I'm so sorry. Is there anybody else that would like to share? Did I miss anyone? Okay. All right.
Can you hear us?
I can.
Oh, this is Washington County in Sandersville, Georgia, and we actually had a good consultative call with Terry about our our strategy map. Or actually, we came up with we have something called the points of focus, which is kind of like a strategy map, and we had different, I guess we called them pillars or whatever you want to call them. And what we try to do is to focus on taking what we've already developed, because we spent a lot of time working on it, and then fitting it into the value strategy map. So for instance, we had a heading of culture and people, and in that we had some goals and actions, and where we found that to fit would be under learning and growth. So we're going to take the goals and actions that we have and kind of place those in the boxes and then come up with our value or our outcome. And then for like internal processes, we had a kind of a pillar, it was called clinically effective care. So we're going to transfer what we have into that, fit it into internal processes. And then when you look at patients, partners, and communities, we had a pillar called provider partnerships, and also we had growth and innovation, so that will fit into that category. And then the last one, we had a financial sustainability, which would fit definitely into the financial area. So what we're in the process of doing is taking our different columns and kind of deciding the same thing you said before. Are they really actions or are they really strategies? And then figure out from there what our outcome is for each, or what our intended outcome is for each of those areas.
Thank you so much for sharing that. That's another great example. Yes, I've known several hospitals that have taken the pillar model, that pseudo pillar type model, and then utilizing this to adapt to the 5 areas versus 4. It works beautifully, and great job. I've seen them very successful, and again, it's a mechanism to think about, are you still capturing all those key areas? And so if you want to have 4 or 5, so be it, making it meaningful to you. And I guess I just want to say, just because you hear those that say they have a pseudo pillar model and they have 5, does not mean that you can't relate it to this. It for sure works. So that's fantastic. And another key comment that I'd like to share is Terry is always available, and I'm very appreciative of the fact you shared that. So please tap into Terry's one-on-one coaching calls. Put him to use. He is a wealth of knowledge and can help you make this simple. And then again, as we move forward in the planning process here, connecting your strategy map to your balanced scorecard, stepping that down. Yes, we will keep it in mind regarding how to connect the dots for strategies, for your strategy map, and then putting it into a meaningful stepwise approach into your balanced scorecard. So we will keep that in mind and discuss that as we move forward. So
hey,
thank
Bethany.
you so much. Oh, Terry, you're
Bethany,
on.
Yeah. Oh, yeah. I've been on.
Yeah.
I'm sorry. I had a little bit of
good.
trouble getting on initially as such. Just a couple of comments here. First of all, very impressed with the good work by the hospitals here. I mean, it's truly impressive in that regard. One of the kind of distinctions between the strategies and the action steps is the strategies will tend to be broader. It'll be, develop HIT technical capacity. That's a strategy. Figuring out how to do that, the education piece of it, the online training, et cetera, would be more specific on that regard. But I would agree with you, Bethany, and some of the other folks that have struggled with this. This is just something that we've worked on over the years, and I always think of it as strategies are much broader, kind of what we're trying to achieve. Action steps are how we're actually going about doing that.
Well, that's a great lead into really the next focus for today. And I'm going to mute myself. I apologize to everyone for the background. My computer is muted. So I will pass the presentation now on over to Terry, and you can sort of pick up on that and move forward. So thank you, everyone.
Thanks, Rhonda. Want to talk a little bit about data collection and the strategic purpose here. What we see in the very typical effort is hospitals collect a ton of data and information, and do that partially because they have requirements from federal and state officials, et cetera. And so we're constantly generating data and information, but we're not always looking at it and deciding which is the most important. So on this is an effort curve we're looking at here, and the data collection is where most of the effort has been in the past. But now, since this is not something we're required to do, this is now we're looking at what is the most important information given our strategies, given the strategy map we put in place. What can we use this data for? So what you see in the effort, which is the dark line, is that we're spending a good bit of time analyzing the data, reporting the data, et cetera, but we're maxing out in terms of analyzing that data as such. So we've totally reversed what's usually the cycle where we're so exhausted from collecting data, we don't have a lot of time to analyze it or to actually use it. So on our balanced scorecard, we're going to take that information and really boil it down to just the most important pieces here. Also, the fact is that kind of the typical way that we have analyzed organizational success is based upon a very old model, where the amount of money you had in the bank and the amount of property you owned, et cetera, was your value. But what we see here is that as we progress to today in 2019, more than 75% of the value of an organization lies in kind of its knowledge workers. And if you look at hospitals, that's a classic example. You know, if you said, what's your hospital worth, you're not going to just talk about, well, the building's worth this, and we have this money in the bank. No, it's really, we have these skilled workers, we have therapists, we have lab managers, we have providers and physicians, et cetera. Their knowledge base is our value. And for that reason, the old traditional ways of measuring our financial net worth has less value today than it did in the past. Still important, but not not the same sort of value proposition here. So it's, you know, how many physicians do we have available? Do we have enough nurses? Are our folks trained? Do they have the proper knowledge to move forward here as we're changing into value and population health payment systems? Are we understanding those? Do we have, you know, somebody to do data analysis and et cetera? So that's what this slide is basically saying. And then, you know, why we want this balance scorecard is we see this rise of difficulty executing strategy because we're exhausted from collecting data and doing all the other things in terms of patient care. We have an over-reliance on financial measures, as I said before, and looking at your financial measures is kind of like looking in the rear-view mirror of your car. You have a great view of where you've been, you know, even if it was last quarter. That was last quarter. It's not current, and so we need to be looking out in terms of the future, thinking, okay, how am I going to develop that value in the future? What are the indicators that I'm hearing right now? Let's say it's staff turnover rates. Let's say it has something to do with customer satisfaction. They're going to have an impact on my financial performance tomorrow. So it's starting to calculate and measure what is called intangible assets. Okay, that's an important distinction. Our tangible assets are our buildings and our bank accounts. Our intangible assets are our leadership, our medical staff, our knowledge base within the hospital, and the loyalty of our patients to our facility. So that's what our strategy map and our balance scorecard is designed to address. So the balance scorecard itself is really something, we're simply measuring the most important things we could be measuring, not just our financial performance, not just our quality scores, but our staff's readiness for the future. How good are our business processes? Are they as lean as they could be? So you can see we're starting to measure things other than just what we've traditionally measured. And it's also a way of linking our operations, our day-to-day work, to that strategy itself, and a way of monitoring and comparing performance. So this isn't going to be one of those kind of benchmark measurements where you could measure yourself with everybody else, but these balance scorecards need to be customized to your facility so that you can set some goals and then you can monitor your progress along the way. So you're benchmarking performance against yourself rather than necessarily against anybody else. There's nothing wrong with benchmarking against other hospitals, but in my opinion, there's more value in terms of benchmarking our progress against ourselves. If we said we were going to reach 25% of our goal by the end of quarter one, are we there? And way we're always keeping our eye on the ball. We're communicating our progress and where we're going, and that basically is designed to be progress that the entire staff can understand. I remember walking into a really good rural hospital years ago. My mother happened to be an inpatient there, and I saw their strategy map right on the wall as I came in, and I thought, wow, this is a great place. And you're going to find that their measurement and the recording and the communicate of your progress and your balance scorecard is something that your staff will be aware of. And so when you're not doing so well, they can recognize it by, if you're color coding it, let's say in red, or if you're doing a great job, it's going to be, in blue or green, or if you're kind of a little bit under your target, then it'll show up in yellow as such. So very good communication tool. So the scorecard's not a magic bullet. It doesn't fix anything. It simply takes everything and puts it into your vision. And for example, we use the balance scorecard in our organization for the board to understand, hey, these are our strategies. Remember last strategic planning session? We all determined we were going to move in this direction, and so because we have to be accountable to our board, it gives us more focus on our balance scorecard. We share our balance scorecard with all of our staff at staff meetings, etc. So it doesn't fix anything, but it sure helps us identify those things that need to be fixed. And it really takes some commitment and effort. I'm really impressed with you folks, what you guys have communicated so far on this call. You get value out of this if you put some effort into it. And as I indicated, we've been using it here at our agency for at least a dozen years, probably more. I've kind of lost count over the years. It doesn't take a ton of effort, and again, it's not something where there's a right answer and a wrong answer. These are basic things for you to look at and decide what's best for you. So again, this financial information no longer sufficient. It has the limited dimensions, and I talked before about looking in the rear view mirror. It's really poor at measuring overall value, and most hospital boards really get into the financial numbers in that regard, but those financial numbers don't really tell them what their role may be in terms of driving strategy. Doesn't really enhance their understanding of why hospital leaders may want to do certain things, like more training for the staff, et cetera. One of the things that I find really useful in the scorecard is if you are trying to get the board to understand why you might have to make investments in times where you're kind of financially troubled. This basically helps to explain to them that I'm going to invest in information technology now so that I'll be financially stable in the future, and since we'll be taking better care of our patients. So this is just an indication of why strategies fail. This isn't a hospital-specific slide, but it just basically is something with organizations across the United States. And it comes out of Harvard Business School, Kaplan and Norton, et cetera. But basically, there's a vision barrier because only about 5% of the employees understand the strategies. It's probably lower in most places. I think that 5% is a little generous. Only about 25% of managers across the country have incentives linked to their strategy. Most of the organizations, 60% in this estimate, these organizations don't link their budgets to strategy. So they have wonderful strategies that are sitting out there, but they don't put any money behind it. And in many cases, not just money, but just resources in general and time, which is sometimes more important than the money. And then the management barrier, because basically because they're so busy, 85% of the executive team spend less than an hour per month discussing the strategy. So we're taking strategy, we're embedding it into a balanced scorecard and a strategy map, and now we're going to solve some of those management barriers. We're never going to get everybody to understand our strategy on our staff, but we can certainly get a significant percentage of them to understand some of that strategy, and then hopefully to identify what would my role as a housekeeper do in terms of increasing patient satisfaction, for example. So, you know, basically, did you want to do this one, Bethany? I don't know if there's any questions about that, but we're going to move into this next phase of our collaborative here, really working on putting a balanced scorecard in place. And one of the things that I would recommend from previous experience, like I said, well over a dozen years, I've also taught this to, you know, 50 to 100 hospitals, something of that nature. So as Bethany had indicated, I'm really happy to help you if you just want to run some ideas past me or just schedule some time. Totally available for that. You know, I travel periodically, but that shouldn't be a problem. Just building in some coaching, or if you just want to shoot me some emails asking some questions as well. One of the things that I do recommend is don't try to put too many measures in, and because it becomes very, very difficult. And if you feel like you're stretching to try to find what would that target be, one of the things you can do is to monitor over a year. You could say, well, you know, I don't really know what a good goal is going to be, so let's just monitor this particular statistic over time. Maybe it's turnover rate, for example. If I don't have a base in turnover rate, and my understanding is most rural hospitals don't have that, maybe the best thing I can do is start to monitor it now, so that next year, so we'll have a rate, let's say after a year, and then whatever that rate is, I'll build it into the scorecard next year so that I can monitor my improvement over time. Bethany, I think I'm turning it back to you here, but does anybody have any questions before I do? Okay, Bethany.
Thank you, Terry. Sorry about that. I was muted. So if anyone has any questions for Terry, feel free to chime in or just type in your question. And I will go ahead and summarize the last slide here as she puts up some polling questions. I'll try to, there we go, regarding the learning collaborative resources. And a few closing comments. First, yes, I totally agree with Terry. Keep it simple. You know, if you notice in the template, there's 4 strategies per category, and that's a lot. So you don't have to have 4. In fact, we encourage you to start with just 2 to 3 at the time, and because as this builds out with your balanced scorecard, it will definitely become more and more. And so keep it simple at the beginning. You can roll items on and off the scorecard and strategy map over time. But keeping it simple at the beginning helps everyone to learn the process. And then to discuss the outline for the strategy map and connect it to the balanced scorecard. So first, we encourage you to download these documents. You'll see that the guide, yes, is in PDF, but the templates are in Microsoft Word. And you will also see that for under the balanced scorecard, when you're ready to use the guide to help you step through the next portion, thinking about your balanced scorecard, the template is intentionally designed to help you lay out that thought process and not get stuck in some of the questions that we talked about earlier regarding is it a strategy or is it an action. So your strategic objective, again, even ask, you know, what is that strategy you're trying to achieve, you know, from your strategy map. So if you follow the template, the balanced scorecard template, you will see for each of those items, there's little questions to help you step through the process so that you don't sort of end up just focusing on action steps the entire time. It includes the initiative or the action steps. It asks you about what measures. It asks you about your target level. What's the performance level that you that best fits your organization. And it includes, you know, how often do you want to measure it? Does it need to be monthly or can it be, you know, annually? And then eventually even ask, you know, to you know, track it through a visual graph. Hopefully the questions in the balanced scorecard will help you tie them back to those individual strategies that you have in your strategic strategy map template, and it's also should be color-coded. So hopefully it's a full working tool to help answer some of those questions. And then the guide itself. And in the guide there is a full example, so I encourage you to look at it. And to build off of Terry's comments regarding financial information is no longer sufficient. And that messaging back to particularly your board is that it really does help you link that quality to financial. In the guide, you will find there's a whole appendix for sample measures, financial, operational, some quality, commonly used metrics that we see in the balanced scorecard. And then that in itself just helps you communicate back to your board and staff how all these other hospital activities really do impact your financial position and the value of the organization. So we're hoping that this is a full process and guide to help you link one step to the other. And then, of course, just again, this is just the documents and the links, and give you a visual, but in the download of the guide. If you have any problems accessing it, then please reach out to Kim. Me and Rhonda will help you send it directly to you. And then with that, I want to say, Terry, is there any other final comments or questions?
No. You know, hopefully you folks are finding value in this. Please, again, we keep saying it, but don't hesitate to reach out to us if there's anything that we can do to help you with that. You know, again, I've been doing this sort of training with rural hospitals for at least the last 10 years. And one of the things that I'm finding is there's much greater interest on the part of rural hospitals now in scorecards of this sort or anything to help them from a strategic planning situation. So again, please take advantage of anything we can do to help you, whether they're online resources or just questions or coaching. We appreciate you guys being a part.
Yes. I had a question, please.
White Mountain has a question.
Yes.
Yes, White Mountain has a question. Hit *2 to unmute your line. Or type in your question. I apologize if we missed you. So I tell you what, if you have your, they're typing now. So while they're typing, I will build off of what